we're doing an anterior cervical discectomy and disc replacement at C5, C6, C6, C7. She's supine. She's got 2 grams of Ansip on board, a gram of TXA. Yes. Any allergies? No. All right, injecting local. 2, 3, 4, 5. I'm sorry, can I take a cast over? Can you put a little bit of wax on this, please? Hey, Chris, can you come on south push up, please? Tap, tap. I'll take the scope, please. Okay, in this case, the patient has really collapsed disc spaces at 5, 6, and C6, 7. The facet structures are still well intact and look good, but that collapse of the disc space has caused a little bit of a focal kyphosis, meaning that the discs collapse forward, tilting the head forward. And normally when you have that malalignment, in setting of course nerve compression and pressure on the structures causing arm symptoms and whatnot, and having otherwise tried more conservative efforts, that neck alignment issue, if surgery is considered, will push folks to normally consider a fusion so that the alignment can be also addressed. But right now, given that we have the right disc replacement technology, you can restore that alignment not by just releasing the structures up front that cause the focal kyphosis, but then also placing an implant that essentially allows for lordosis or kind of restoration of that sway back. Hey, 5-degree lordotic implant, medium footprint. All right, Chris, come on south for a shot. That's the posterior there, lines up with that. Right, Blair? Yeah, we'll take that. Okay. I think that depth-wise, everything looks good. Footprint-wise, I think that looks good. Look at that. Send that to corporate, will ya? Come on, Al. Yeah.